to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for Tuesday, December 4th, 2018. We have an orthopedic surgeon on the program tonight. Not going to be in studio, but hopefully if everyone's driving around, they're a little careful in the misty, rainy conditions and look like New England or Foxborough, look like the Patriots and Vikings game on the drive-in today. So be careful out there. I know one of our guests for tonight, our guest, Dr. Sophia Deben, is safe, so I'm going to have her patched in the phone. She is an orthopedic surgeon, and she's with International Orthopedic Specialists. Dr. Deben, welcome to the program. How are you doing this evening?
David, thank you so much for having me. Such a pleasure to be here on the phone with you. I am parked next to an accident waiting to be allowed to go past it. So I don't think I'm as good as you, but I'm so grateful to be invited onto your show.
Oh, thank you for taking the time still to call in, and we're glad you're safe. And I just want to start out, I read a lot about you in the last few days, and I just want to say thank you, first of all, for your service and keeping us safe. Can you tell us a little bit about where you served?
I can. I took a scholarship to pay for medical school through the United States Navy, and when I finished all of my training, I served first at Naval Hospital Camp Lejeune with the United States Marine Corps. I then deployed to Iraq with the 2nd Medical Battalion, also attached to a Marine Corps unit. I was then stationed at Naval Medical Center San Diego in San Diego, California. And I've had other duty stations in Jacksonville, Florida, as well as in Okinawa, Japan.
Wow, well, thank you for your service again. I appreciate it.
It was a wonderful experience, and I was proud to serve my country as well as, have a way to pay for higher education. It was a great experience.
That's great to hear, and of course, we're so happy to have you on the program, talk a little bit. I always say it's an adventure in health because we always learn so much from our doctor, our physician guests. And I know we've had a lot of orthopedic surgeons on the program, but every time I ask this question, it's a little different because everyone's getting more super specialized nowadays. So please tell the viewers and listeners about what you do, your medical specialty.
Sure. I'm an orthopedic surgeon, and that is the category of doctor that takes care of your bones and joints from your neck down. Sprains and strains, fractures, injuries from sports, injuries to your bones and joints and tendons after bad accidents, sometimes infections. And that's the general type of doctor that I am. I am a clinical doctor and a surgical doctor, which means that I operate on patients as well. My subspecialty, as you mentioned, David, very correctly, we are all incredibly specialized as we are growing in our understanding of anatomy, and our technology is getting better. I am an orthopedic foot and ankle specialist, which means I have an extra concentration in foot and ankle surgery. I completed a fellowship in Portland, Maine, with the University of New England, and have been focusing on diseases of the foot and ankle now for several years.
That's fantastic. Yeah, so the foot and ankle, do you deal with mostly patients that are athletes, or do you deal with the baby boomer population, seniors, or a mix of just about anyone who needs a foot and ankle specialist in South Florida?
Well, David, the good news is that I deal with anyone who has feet. So that makes it a little bit easy. It's wonderful because I have the opportunity to treat baby boomers who have more diseases related to arthritis, flat foot, diabetes, bunions, hammer toes. I deal with athletes who have sprains, fractures sometimes, people who are missing chunks of cartilage like a pothole. We call it an osteochondral defect. Sometimes when you sprain or break your ankle, not only do you injure the tissues around the ankle, but you can injure the cartilage or the lining of the joint on the inside of the ankle, and that can cause quite a bit of disability to the athletic population. I also have had an opportunity to deal with people who have had severe trauma. When I was in the military, I took care of a lot of patients who were victims of bombings and explosions. I took care of a lot of special forces who were jumping out of airplanes and helicopters and sometimes didn't quite land correctly on their foot or ankle. So I did quite a bit of reconstructive work. But basically, I will span the gamut of pretty much anything that can happen to the foot and ankle. I can manage or get the treatment going in the right direction and bring the correct team of specialists in to fully treat the patient.
Hey, that's a good point. I mean, landing an incorrect way and twisting foot, or even taking the wrong step. I know I've had that before where I've felt some pain. So it can be the foot and ankle. There are so many different ailments, so it can be a lot of different things. So, is your practice 18 and up? Is that safe to say, or do you deal with anyone under the age of 18 as well?
I will take care of about 13 to 14 and up. If they have anything that is concerning to the growth plates, I will send them over to a pediatric orthopedic specialist. Every so often, there are certain kinds of fracture that smaller children can get that can change the way the growth plate forms and can change the way the limb or the leg grows over time. But most of the young people that I take care of that are in the 14 to 25 category are athletes. They are going to dance class and they are playing basketball and they are playing football with their friends, or they're out water skiing and they have a sprain, strain, or fall that requires a little bit further attention. I'll tell you that most of the sporting accidents that occur to most of us are, like you said, you'll be walking and maybe not paying attention, or maybe playing a sport and twisting a little bit, and you'll sprain or twist your ankle. And one of the easiest things to do to treat that is a little bit of physical therapy to sort of wake the muscles around the ankle back up. But unfortunately, like most of us, we're really busy and we try and sort of walk it off. And so some folks, after they have those kinds of injuries, will try and get back to playing sports and back to their regular life, and they'll still have pain and disability. So they come to see me for definitive management.
I like how you mentioned physical therapy there, and you mentioned non-surgical approaches a few times. How often is a non-surgical approach available in foot and ankle injuries? Meaning, like, I think when a lot of people sometimes see orthopedic surgeons, I think the general public sometimes may think, I have to have surgery, or, but sometimes there's a lot of non-surgical approaches that you'll look at. Is that correct?
That's exactly right, David. The reality is that we have the time, experience, and training and knowledge of seeing all sorts of diseases at all of their stages. We see the 16, 17, 18-year-old volleyball player at their first sprain, and we see them when they're in their 20s and 30s trying to play on the weekends, and they never took care of their sprains when they were 17 and 18, and we see them when they're 40, 50, and 60, and now they have some ankle arthritis. And so the good news about seeing a surgeon is that you get an opinion from someone that has seen the best and the worst. And they can look at your specific situation, your activity level, your age, your weight, your x-rays, your function, and give you some good recommendations to help you achieve your goals.
That's great. And so let's talk a little bit about your office. So you're at International Orthopaedic Specialist. That's located in Miami, and it's I think I saw on the website it's a two-physician. You're one of two physicians in the office.
You know, I have kind of a really interesting office. I have two locations, one in North Miami on 123rd, near North Miami, Aventura Ball Harbor. And in my office, I have one direct partner that's a sports and shoulder and elbow specialist, but I also have podiatrists and I have trauma specialists that are in that space. And so it's nice for the patients to come in and be able to see several doctors if needed, get x-rays, get casting, and we have physical therapy right next door. I also have another location down south in South Miami on Sunset Drive that I am able to offer the same services, x-ray casting, injections. I'll also do some stem cell work. And then we have recently also started prescribing a little medicinal marijuana as well. So you get the whole bag.
Oh, okay, that's good to know. So you're one of the doctors that can provide, I guess it's labeled compassionate care or medicinal cannabis or marijuana. So that's good to know. If anyone needs to jot down or go back to this program, you can go to allcountyhealthcare.com. There's a radio tab there. You can see all the shows, or we're on Facebook as well on All County Healthcare Incorporated's Facebook page there. All the shows are there if you want to go back and take a look. Grab Dr. Deben's information as well. We got it up on the screen. Her number's 305-674-5956, and she's at International Orthopedic Specialists, two locations in Miami, one in the Aventura area that she was just telling us about. Love that area, and I also love South Miami, so you're in two of my favorite spots when I'm in Miami-Dade County. We have listeners and viewers all over the world, but listeners right here in South Florida, a lot from Palm Beach, Broward, and Miami-Dade County. So this is fantastic. The website for Dr. Deben is internationalorthopedicspecialist.com, or you can Google Dr. Sophia Deben, and a ton of info comes up, as well as a website tab. Dr. Deben, when a non-surgical approach is something that's maybe not going to work for the patient, it's time to take to the next level, where do you do your surgeries at?
I primarily take care of my patients surgically at the Surgical Center of Doral. It's in the Doral neighborhood right next to, I think it's the new Fresh Market. It's a wonderful outpatient facility. We are able to offer all of the new technologically advanced treatments, to include all sorts of different kinds of stem cells and the new sports equipment that we've started using for things like ankle sprains and ankle ligament reconstructions. It's a wonderful space. We have an over 95% patient satisfaction rating. Our anesthesiologists are exquisite. They really spend a lot of time giving the patients both the sort of central anesthesia, but the peripheral anesthesia that helps them be put into a car and be driven home. Much of what I do is on the foot or ankle, so we're able to numb up the nerves of the foot and the ankle, and we can bypass general anesthesia. So right after the surgery, you're awake and alert. You don't have that sort of heavy grogginess. One of the special things about using a surgical center is that, and then the other is that we have an incredible amount of efficiency. It's usually a very affordable option for patients that may have high copays, and they have a very, very low infection rate, which is important for everybody.
Isn't that great? Everyone, like the way healthcare is changing, where there's opportunities where people can have a surgery and leave the same day. Dr. Deben was just talking about, having someone drive you home. Well, it's changed a lot in the last few years, and that's great. And obviously, low infection rate is another plus as well. Dr. Deben, I wanted to get into a topic that over the last few years, I've mentioned this a few times, has come up, and that is limb salvage. Actually, just this year I've started talking about it. I don't think I knew about it before that, and I've also found out that it's great to have a doctor of podiatry medicine or orthopedic surgeon in your Rolodex nowadays, because if diabetes does kind of onset, it seems like one of the first places that it goes is in the foot. And to have a foot and ankle surgeon already talking about limb salvage, it's just amazing. And tell us what limb salvage is and when it is needed.
Of course, yes, that's a wonderful point. I agree with you. Diabetes is quite prevalent. It's very highly related to the obesity in the United States. When you have a high blood sugar for a long period of time, sometimes the high blood sugar not only affects things like your retina or your blood vessels, making them harder, but it also affects the nerves to the foot and ankle. And so approximately 25% of patients who have diabetes for over 10 years will have something that we call neuropathy. Neuropathy is essentially the word for dysfunction of nerves. What patients with diabetes suffer is the loss of protective sensibility, which means that the little bit of rubbing that you and I may feel from a shoe that doesn't quite fit right, or if we happen to step on something sharp, maybe a glass that had broken a day or two before in the kitchen, and we get just a small shard that's sort of left over, you and I would feel it, but someone with diabetic neuropathy won't feel it. And they'll walk around for 2 or 3 days with that little piece of glass working its way into their foot. And as you can imagine, the way we walk and the sweating inside of the shoe, it's not always the cleanest situation for a wound to heal. And so diabetics with neuropathy are significantly increased risk of developing an infection. Limb salvage is when a patient develops a condition that is so complicated, it usually involves loss of skin, loss of muscle, infection, loss of blood flow, that it is a reasonable treatment alternative to amputate the limb. And so when infections get bad enough that they're deep inside the bone, when there are perhaps a burn or an explosion, sometimes people undergo what we call a traumatic amputation. They sustain a fall or a bad car accident, and part of the foot is lost. We really have to assess what's going to be the best thing for this person to return to their life. And so limb salvage is a way for us to use all of our specialties, our plastic surgeons, our infectious disease specialists. We also use something called hyperbaric therapy, those special chambers that are used for patients who have been diving and had a diving accident. We can manipulate the amount of oxygen in the environment and provide more oxygen to the skin and the soft tissues to improve healing and decrease infection. And so we can work together as a team to try and reconstruct salvage a limb so that the patient can get up and walk from their bedroom to the bathroom without having to put on a prosthesis. And so limb salvage is a multi-specialty complex care for the complex injury. Thankfully, very few patients really need limb salvage, and most diabetics who follow recommendations such as good glycemic control or managing your sugars, taking your medicine, checking your foot every day, doing your foot checks, and following up with your physician every 4 to 6 months, depending on whether or not you have neuropathy for a foot check, is enough to maintain foot health. Another thing that we recommend to patients who have neuropathy is to be in a special liner, kind of like a Dr. Scholl's specifically made for the diabetic, to protect them from the loss of feeling, as well as diabetic shoes. And the good news is that even though most health insurances, actually none of the health insurances will pay for custom orthotics or removable shoe inserts, if you have diabetes with neuropathy, regardless of your health insurance plan, whether it's an HMO, a PPO, Medicare, Blue Cross, doesn't matter, they will all pay for the special inserts for diabetics as well as diabetic shoes every year, because it's a real public health problem when someone is unable to use one of their 2 legs to be able to walk safely, or they become sick. If you think about it, you got one leg out of commission, you're suddenly relying on 2 arms and the other leg. And once we get into the 50, 67-year-old age range, we get a little bit of arthritis in our hands, wrists, or shoulders. We've got an extra 20, 30 pounds. Maybe we can't see as well. It's really, really hard to get around in our life, to clean our house, to make ourselves a sandwich, to get in and out of the bathroom while we undergo treatment for a diabetic foot ulcer or foot infection. And so thankfully, our public health system has created a way for patients to utilize their insurance to get the sort of preventative orthotics and shoes that can significantly change their quality of life.
Now, there's something we can celebrate about the public health system. That is great. I never knew that. That's one of the things we can, right?
Right?
Yeah, definitely.
Short lives nowadays. I'm so sorry, but that is definitely one of them. And I often get patients who don't really. They realize they have diabetes. Maybe they're good with their diet. Maybe they are not. But they kind of shy away from seeing the foot doctor because they know that most of the things that you need for shoes, orthotics, a lot of that stuff typically isn't covered. But when you have diabetes and neuropathy, all of that's covered, and it's covered annually. So I think you get 2 pairs of inserts and 1 pair of shoes every year. It may be a little bit more than that, but it's definitely the right direction.
Yeah, that's a no-brainer. That's great news, and thank you for sharing that with us. What you said before also hit home to me. So a lot of people know I'm a public relations manager for one of the healthcare systems by day in the area, and I've been a writer in this area since 1999. But I did a testimonial on a man, and he had just changed shoes, and he's diabetic. And that thing had happened that you just said to the T, exactly what you said. His foot had rubbed up. The shoe wasn't fit right. It wasn't. You know how we work shoes in. Women do this a lot with their shoes. Men do this a lot with their basketball shoes as well. You got to work them in until they get right. And what had happened, it had rubbed the skin off this man's foot, but he didn't feel it, so he kept on wearing the shoes, and he went to the beach, walked on the sand, etc., trying to stay, as healthy as he could with the diabetes going on, and it had rubbed a hole in his foot the size of a quarter, and it came to the point where he almost had to have his foot removed. So what Dr. Deben is saying is right on about limb salvage. If you have someone you can jot down, like Dr. Deben's info, which I'm going to give out, about limb salvage, keep that in your back pocket for, Rolodex for family, friends, etc., yourself, because it could save a limb in the if that had ever happened. And I know the mortality rate's lower if you're able to, live life with all your limbs intact. Dr. Sophia Deben is with us, international orthopedic specialist in Miami and Aventura area and South Miami. Check her out and grab the address at internationalorthopedicspecialist.com, 305-674-5956. Got a great picture of her up on the air here. And this program is on allcountyhealthcare.com and the All County Healthcare Facebook page as well, and we'll put up on YouTube. Dr. Deben, it's hard to believe we have less than 2 minutes left, but I'm so thankful for you calling in. I know there's some info about scientific journal articles you wrote on the flay foot and subtle cavus foot, and I want to push people to the website for your education and training, as well as the little bit about those articles. But maybe we can talk about that next time. I want to ask you, what are your hobbies and passions in life outside of medicine?
I love our South Florida lifestyle, being out on the water, fishing, swimming, diving. It's all wonderful. We're lucky to live in paradise every day.
Oh, you couldn't have said it better. I feel the same way. I do those things as well. Thank you so much for taking the time to call in. We'd love to have you back on in the future and talk a little bit more about the foot and ankle on the You and Your Doctor show.
David. I would love to. Thank you all. Take care.
You too, and that's Dr. Sophia Deben, international orthopedic specialist. Thank you and good evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.